The important conversations that we should be having are like the one that I'm about to share with you. I sat down with Martha Isabel Wydra. You've probably never heard of her, but she's a registered nurse in critical care here at a major, huge hospital called the University of Miami Hospital. And I met her alongside other fellow members of the 1199 SEIU. It's the United Healthcare Workers of the East. And I met them at the No Kings Day 2.0 protest, and they were fantastic. Their energy, their message. And when Martha and I were speaking, I was struck by just the stories that she has to tell about her interactions with patients and how the big bullshit bill and how everything that this administration is doing is impacting not only them as nurses and healthcare providers, but also all of us. We're all interconnected in one way, right? She says, quote, the system is abusing the people, and she is damn right. She also had some other important words to share, so take a listen. And joining me now, I have the privilege of being able to introduce you all to Martha Wydra. Martha, please let the people who are tuning in know where do you work and what do you do?
I'm an RN, now becoming a DMP in critical care, working at the Utah or University of Miami Hospital for about 15 years.
Okay. And for the people that don't know, an RN is a registered nurse, and you're working towards what new position?
Okay, I'm a registered nurse in critical care, especially in cardiac and surgical. And I just graduated from Nova University as a doctor in nursing in practice with a specialization in critical care.
Well, congratulations on that. I know it's not easy to work and to go to school. And where are you originally from?
Colombia.
Okay. So, Martha, you are a member of the 1199, which is the union that is the United Healthcare Workers East. Talk a little bit about why that union is so important.
Well, I've been in the union almost since I got started working at University of Miami Hospital, and I believe the United we are stronger. So I think being part of the union is a crucial aspect of our career, because that's the way that we actually have to stand for each other in a better way.
Do you feel, Martha, that under this particular administration with Donald Trump as president, that he's been going after the laborers and the unions in a way that's not particularly helpful?
I will say I don't go against people, but I'm very down for the way that the law and the government is managing the services to their citizens. That at the end of the day, we are the one who place the government in place. I don't know if that makes sense. We, the people, place them there, and now feeling that they are against us in this way is very, it's hard to digest.
Yes, I agree. So, Martha, let's talk about something. There are a couple of things that I wanted to focus on with you. You are on the front lines alongside your fellow healthcare workers when it comes to directly interacting with members of the community at their most vulnerable moments. They are sick. They are scared. They are frightened. They don't know what's going to happen to them. Talk about why there is even more fear lately when you've been dealing with some of these patients.
It breaks my heart. I'm in my career, not just for a paycheck. I'm here for vocation, because I do believe that as nurses, we make a difference in the medical field. We make a difference in people's lives every day. And it's very hard when you see a patient coming from the emergency room in severe chest pain, and most of the symptoms are related to the fear of being deported to their countries and being the only person paying the bills and putting the food on the table, and paying even the taxes and paying and doing everything in the legal way. But unfortunately, for whatever reason, they don't have papers. Okay. I know in court, I know saying it's okay to be illegal, but it's horrible when you are living these circumstances and you cannot even go and look for medical assistance because either the cuts that we are having to the ugly bill or the immigration chasing the people. So at the end, you have no leg to stand on. And it's really hard.
Yeah, Martha, I want to talk about, you had mentioned to me, it was very sad that these are very real people that you are dealing with. You recently had a man that came to you with severe high risk of stroking out, frankly, anxiety, but he did not want to go to the hospital originally, but it got so dangerous for him that he had to. Talk about your interaction with him.
When we start actually talking with them, with the doctor in the emergency room and trying to understand why he was in so much pain, his blood pressure was super high, that we were concerned that he would stroke, which would place him in disability, permanent disability, or he would end up just dead at the moment, having family at home waiting for him. And one of the reasons that he was expressing, because we asked, why you wait to this moment? He said, I'm afraid to even get out of my house because I can get deported. I can get in the hospitals and the street and the gas station, whatever. So he was in so much fear that was aggravating his medical condition.
And he was sharing with you that he has children at home. He's a provider. His health, his physical condition is so important to continue to be a part of his family, huh?
Exactly. That's the sad part, because we are not affecting these individuals. We are affecting a whole society. We are affecting so many people in this moment that they don't have a way to go. We want to provide the service. We want to help. We want to collaborate in getting these patients better. We cannot go to their houses. We cannot go to the places that they are hiding. Well, do we have to just wait for people to start dying in the middle of the street for lack of service because either they are in fear or they don't have medical insurance or they don't have access to healthcare providers? I don't know.
So there's a couple of things that you just said right now that I think are important for people to understand. And again, you as a critical care nurse, you are dealing with these people, these patients on the front lines. So for example, at the University of Miami Hospital, it is one of the few hospitals that you can go when you don't have health insurance, when you don't have money, but you need medical care. Have you noticed that there's been less people showing up in large parts because of fear of being deported?
I don't want to speculate because I don't have the data in my hands to sustain my words, but I would believe so.
Okay. And then there's also the prospect now, based upon the big ugly bill that was passed. I call it the big bullshit bill that was passed recently, but that people's healthcare premiums, whether they get it on the Affordable Care Act exchange, Obamacare, or where they get it even privately, the amount of the premiums are going to be so high that a lot of people are not even going to be able to afford to pay for their health insurance anymore.
I don't know if I should share this right now, but we have a situation at home, and for different reasons, I have to work part-time. The amount of insurance that we have to pay for me and my kids are just no way for me to afford it. Absolutely no way for me to afford it. So I have to look for other options. I do have a health insurance there, but I'm just giving you one sample, and I work and I'm legal. So when you go and try to dig and what we are seeing out there in the community with people making the minimum in salary, these people, they actually go to collect the tomatoes for us to have a nice healthy salad. The people, they are say, when you have a leak in your house and the insurance doesn't cover you until you don't change your roof, who's doing those roofs? Most of the people is not people who has a title as a lawyer, as accounting, as a nurse. It's people that actually came to this job, and those are serious jobs. I mean, this type of the jobs that we are talking about are risky. Okay, being a police officer is really hard and challenging, but being a roofer with all these chemicals and things like that is really hard. And we have to put our head in our heart and think exactly what we are doing to the community. What is the United States? We are built on immigrants. And the only immigrants, the only people that are not immigrants are the Indians, and they have their own law and they're all a little pieced in apart. So in general, it's like we are hearing to our own people. Most of the people here, they came from another country. Back in the days, every single person from the top to the end of the bottom are coming from different countries in Europe, South America, Africa, whatever is the case. So,
and as a part of the 1199, healthcare workers are also being faced with losing their jobs. For example, we have hundreds of thousands of federal workers that don't have jobs now, right? They've been furloughed. How do you provide good service to patients when you don't even have enough staff to be able to do so?
Giving you just a couple of numbers there. 1.2 trillions, no millions. No 1.2, no, 1.2 trillions are right now part of the cut to fund the medical field. And that includes hospitals, nursing homes, and you name it. So they are cutting this for the Medicaid, and Medicaid to now pays about 70% of the medical bills. And even though the patient is responsibility for some amount of money. So if it's hard right now to pay that amount of money that they need to pay when they are leaving retirement or something like that, how are they going to be able to pay the 100%? Not only that, the hospitals are saying that they don't have enough money to pay to the every employee, and there's going to be cuts, and there's going to be cuts also in personnel. And we are short as it is. We don't have enough nurses. We don't have enough people.
Yeah,
we need more.
Yeah, and the nursing profession has already not had enough people going to school and being able to do the work. And now with these cuts to funding, as well as to, for example, hospitals that provide care that's subsidized by the federal government, for example, there are not going to be enough people to be able to treat the patients that come in.
This is a cycle, right? So the patients are not going to be able to get medical assistance because they cannot afford insurance, or they are afraid of getting by immigration department, or we're going to have a patient that's not going to have a nurse or enough medical help to assist them, especially when they're in crisis. So if either end, we're going to end not good. Because again, if we don't have the nurses, if they made these severe cuts, they're talking about cutting in about more than 12,000 have jobs right in Florida, just in Florida. 12,000. Well, let's do the numbers. How many nurses do we need in one single hospital? Yeah. And it's a fight that we cannot really fight, because against who? And sometimes even if we are putting all these facts, because this is not making things up. This is actual facts and numbers, actual facts and people, and the way that they're affecting our, all people, our kids and our employees. Nobody's getting safe, except maybe some people are high up, that they don't have this need to relate in insurance or Medicaid or anything like that. And what do you guys think about this? None of us are getting younger. All of us are getting older. What are we going to do?
Martha, I wanted to ask you, you explain things clearly so that people understand. You have a very personal, kind of angle to it. Do you think people that voted for people who voted for Donald Trump, voted for this administration, do you think they understand exactly how bad a decision it was to be able to do that?
I don't think so. I don't think so. And again, I bring myself to be very political in colors and go this. I go by ideas. All my life been go by ideas. I believe in changes. I believe in rules. I believe that we have to organize. I believe that sometimes people abuse the system. So this now is going totally the other way around. The system is abusing the people, which is not right. I don't think that we should have place in this position, okay? Because when people vote, it's because they want to change. When people vote for a specific person, it's because we are having faith and hope that things is going to get better. Better for who? So right now, this is not better. And again, I'm not against rules. I believe the immigration has to have some control. I think that it's like if you open your house to me and I get to your house, not me, with my cat, my dog, my snake, my uncle, my family, my friends, and I say, you know what, I'm taking over. that's not right. You are supposed to put the rules and I'm supposed to respect your rules. But if I get to your house, you let me stay in your house and you say, okay, bring your grandma and your uncle, your kid, and they use places to clean your house every day, to go work and get money for you, to go. That's a slave. That's another thing. So you understand what I'm saying? It's just a sample that we have to find a common ground where the benefit has to be for all of us or for none of us. This is just getting a system that's kind of abusive to the people.
No, and to your example, it's you invite them into your house and then you have them cook and clean and do everything, and then after that you say you quitar them, you get rid of them, right? You kick them out,
Mm-hmm.
right? After they've brought their whole family and everybody's been working together, etc. You know, Martha, I wanted to kind of explore something with you because I find it to be so impressive. You are technically, you are a survivor of domestic violence, but you now say that you're an advocate. You are a domestic violence advocate. You have a nonprofit foundation. Talk about why that has given you the strength to speak out publicly about how all of this is impacting you as a nurse, your fellow healthcare workers, your fellow union members, and why you think it's so important for people to organize and to get out and express how they feel about what's going on.
If I apply, thank you for the question. And if I apply my personal experience to the situation in the country right now, is we cannot continue to live in fear. Fear is a killer. Silence is a killer. In my personal experience, I had to endure domestic violence for very specific reasons. Okay. And sometimes don't ask why, because the why has so many answers that it is sometimes hard to comprehend. I almost lost my life due to domestic violence. I have facial reconstruction. I have kids. They had to witness it. And I almost lost, I lost too much. And I have also a daughter who went in a really difficult situation. And one day I spoke to her. She was in college and I had two little ones. I have a 7 and a 9. And I'd say enough is enough. Enough is enough. And standing and being quiet is not working. Not defending your rights is not okay. That's how Wings to Freedom Foundation, a nonprofit, came to life. Because I believe in the rights of the people, because I believe that we have the right to get assistance, to get help. And believe it or not, just talking about domestic violence and the foundation, we have absolute correlation with the changes in the government and the changes that we're doing in the medical field and all these cuts. We are all together in this. So in domestic violence, I create that foundation and I've been helping people and I feel so honored for being recognized and my foundation and for having victims coming to say, you help us or you help me to get out of the situation and you're providing for us psychological assistance, in some cases financial assistance and many other things and raising awareness. But even that, even for the nonprofits, even for all these foundations helping assisting people, those cuts and those changes are affecting us. So everything is related. So again, and I refuse to stay quiet and I'm standing not just for my rights. I'm standing for yours and for everybody else.
Well, thank you for being in the fight with me, with everybody else who's tuning in. Martha Wydra, I am a huge fan of you, your voice, and I'm grateful. I'm grateful you're alive. I'm grateful you are here to have this conversation. And I, invite you always to come and speak about what's going on because, again, you're there, you're experiencing it. Some people are just reading about it, right, Martha? But you're actually involved in it and you're dealing with the patients. And so thank you for also being a nurse. My mom was a registered nurse for many years. So I know what a tough job it is, but it's an incredible job. So thank you so much for joining me today, Martha. I really appreciate it.
Thank you. I want to just say last, I wanted to put up there 1199 SBIU. We are creating a strong bond, okay, together we're stronger. And the union has been helping us a lot. And I think that this is the way to go, to show them that we have a voice and that voice needs to be heard.
Well, thank you. Yes, the 1199 SEIU. You guys were very loud and very amazing at No Kings Day 2.0. So thank you to the union as well. Thank you.
Thank you.
Katie Phang here. We launched the Katie Phang News Channel in partnership with the Midas Touch Network so we could bring you the latest in legal and political news. Straight, no chaser. So if you're a fellow truth teller, hit that subscribe button and share the word about this channel so we can build a high information America together.